Welcome back to Eyewitness News Unscripted. We all know that unfortunately, pancreatic cancer is one of the deadliest cancers, deadliest diseases in America and throughout the world. However, there is some good news. Modern technology is hopefully going to create some solutions for diagnosing and treating this horrible, horrible disease. And right now, we're so happy to be joined by Dr. Kevin Billingsley. He's the Chief Medical Officer at Yale Cancer Care and Smilow Cancer Hospital. So, Doctor, thank you, first of all, so much for joining us here. I know you're a busy man, so thank you so much for making the time for us.
It's really a pleasure to be here. Thank you for having me. And as you said, it is a very exciting time for those of us who treat this very difficult disease.
Yeah, it's always been, unfortunately, certainly a disease that we've talked about a lot in the media and talked about just with our family members about how difficult and obviously often deadly pancreatic cancer can be. I do want to start with the negative. Why in the past has this been such a challenging disease to treat and also to diagnose?
Yeah, let me give you some context on that. And I'll share that I'm a pancreatic cancer surgeon and researcher. And this is really, we're coming into a new era. And I think that the difficulties have been over the years related to a variety of things. One is that we tend to diagnose the disease relatively late. Often pancreatic cancer has spread, unfortunately, at the time of diagnosis, which limits the treatments. And when we treat the disease with chemotherapy, the tumors are often very resistant to chemotherapy treatment. And that's why it has this very ominous reputation. And we're all familiar with stories from the popular press and celebrities who unfortunately have passed very quickly from pancreatic cancer.
So, of course, I feel like everybody knows somebody, maybe a family member, maybe a loved one that has been impacted by this disease. And again, thank you so much, Doctor, for providing that cancer or that context for us. Again, we're joined by Dr. Kevin Billingsley. He's the Chief Medical Officer at Yale Cancer Care. But the flip side, finally, there's some really great developments on the technology side that could hopefully help, whether it's prevention, whether it's diagnosis and treating this disease. So, Doctor, the floor is yours. Kind of what should we be so excited about?
Yeah, let me just give you the big headline. For many, many years, we have treated pancreatic cancer with a combination of surgery and chemotherapy, and in some cases, radiation. And, I will tell you that the biggest breakthrough that has occurred just in the past several months is a big step forward in the chemotherapy for this disease. There is a new drug that's called daraxonrasib, which is the evolution of a strategy to treat something called the RAS oncogene, which is one of the primary molecular drivers in pancreatic cancer. So this is not new.
Right.
Researchers and drug companies have been working on this for a long time, but with this new agent, it successfully targets and limits the effect of this oncogenic molecule in a way that we have not been able to before.
So, Doctor, will this primarily help with treatment then, is what it sounds like, right? Or will it also help with early diagnosis?
No, this is really a breakthrough in treatment. This agent has really doubled the survival in early clinical trials over standard chemotherapy. And what is truly remarkable is that this is a pill form of therapy,
Wow.
which is relatively easy to take. So to say that this is a game changer is not an exaggeration. I think that this is going to be a help and a breakthrough for patients, not only with relatively early stage pancreas cancer, but those folks dealing with disease at the later stages where treatment has been so difficult. I
That's
will go
incredible.
on and say briefly that, yes, you're right. There are also steps forward in the diagnosis, and that, like many things, relates to artificial intelligence, AI. We've learned that the application of artificial intelligence to CT scanning, which is one of the ways that we diagnose pancreatic cancer, is allowing us to pick up these tumors at a much earlier stage, which renders them more treatable and hopefully curable than we have in the past.
Yeah, Doctor, I was going to ask you about artificial intelligence, kind of the big picture of it, because listen, there's been a lot in the media and certainly a lot of discussion about there are negative impacts from artificial intelligence and there are positives, just like with any newer technology, although AI has been around a while, but certainly the generative AI is a little bit newer, at least in terms of being in the front of people's consciousness. But do you believe that artificial intelligence will lead to kind of some more game-changing advancements? Because it does seem like, not just with cancer treatment, but even with other illnesses and diseases, that it could lead to some advancements that could hopefully make people live longer or healthier lives, right?
Absolutely. And I think that this is one of these areas where we will see dividends from AI. Um, what we have found is that artificial intelligence, when it is informed by massive amounts of data from many, many CT scans for patients who were later found to have or develop pancreatic cancer, allows the program to pick up very subtle changes in the pancreas gland that are below the level of detection, essentially of even the most skilled radiologist, which gives us a set of clues and early warning signs. Now, of course, the actual diagnosis requires more investigation and will require things like biopsies. So it's not in and of itself enough to make the diagnosis and lead to treatment, but it will, I think, prove to be an important tool for earlier diagnosis and hopefully saving lives.
Again, we're so happy to be joined by Kevin Billingsley. He is the Chief Medical Officer at Yale Cancer Care and Smilow Cancer Hospital. So, Doctor, I do want to ask you, though, we're so thrilled about these advancements in treatments as well as potentially with diagnosis and that happening faster. But obviously, it's still so important to try to catch cancer as quickly as possible. And with some of these cancers that we're talking about today, it can be a challenge because the symptoms are a little bit quieter. So are there any tips that you have for just people watching right now about ways to, whether it's seeing a doctor earlier, whether it's knowing when to seek treatment, that you might have for people, particularly with pancreatic cancer? I'm sorry to interrupt.
Very, very important questions. And I would say a couple of things. One is that the risk factors for pancreas cancer are the typical things. Smoking is actually one of the biggest risk factors. So we encourage all of our families, patients to pursue healthy habits, moderation in alcohol, exercise, and of course, no smoking. Now, in terms of early diagnosis, one of the things that we have learned is that for any reason, elevation in blood sugar for people who are pre-diabetic or even early in diabetes, a sudden change in the need for blood pressure or blood sugar control or insulin is one of the early markers of a change in the pancreas gland, and that's an early sign that should be investigated by a patient's primary care team.
So there are things certainly that people can do. Does family history play a large role in pancreatic cancer, or is that something that is more associated with other cancers and diseases?
Well, again, excellent question. And there are families of where pancreatic cancer is a known risk, and there are certainly genetic syndromes where pancreatic cancer is a risk. The so-called Lynch syndrome, which is more known for colon and endometrial cancer, is one, but that syndrome is also associated with an increased risk for pancreatic cancer. So for people with a family history of particularly any gastrointestinal cancer, that should be brought to the attention of their care team. And we have very good genetic counseling and testing programs here at Yale and other cancer centers across the state. Unfortunately, the vast majority of our patients who are diagnosed with pancreatic cancer do not have a well-defined family history. So something we're all at risk for, and we all need to be vigilant.
And Doctor, one last quick question. Because of these new technology advancements, are there different questions that patients should be asking their physicians?
100%. These newer therapies are going to be most available at high volume cancer centers that have a clinical research program. The drug that I was just describing is now going to be available through an expanded access program. We anticipate having that for patients here at Yale within the next couple of months. We did participate in the early clinical trials, so we have firsthand experience with this agent. So I think asking the questions about, is your provider experienced with pancreatic cancer and what volume of patients is seen in that center or site on a regular basis will give you a sense of what the availability of drugs, new treatments, and technologies are.
Dr. Kevin Billingsley, again, the Chief Medical Officer at Yale Cancer Care and Smilo Cancer. Thank you so much for joining us here on Eyewitness News Unscripted with some really great news about cancer care and treatment, and especially pancreatic cancer. So again, thank you so much again for joining us, sir.
Thank you. Have a great day.
You too. All right.